Dr. Schwartz, I want to start with you. Do you think it is the role of the federal government to be tracking outbreaks like cyclosporiasis?
Senator, thank you for scheduling a meeting with me, and I hope to have a very productive conversation with you next week. I absolutely believe that one of the core missions of the Centers for Disease Control and Prevention is tracking outbreaks domestically and also internationally.
Right now, in the United States, a parasite is moving through the food supply in 34 states.
And right now, measles has infected more Americans in 7 months than in the past 35 years.
And right now, in Central Africa, an Ebola outbreak has killed more than 1,000 people, with confirmed cases already carried by travelers into Europe.
So that's 3 outbreaks. One country's food, one country's children's, and that's one plane ride away from the United States.
So here's the question we want to sit with today. It isn't which disease is the most dangerous.
This is who exactly is in charge with the response to all of this.
I'm Dr. Haydée Brown.
And I'm Dr. Sonya Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and beyond. So as physicians, we're trained to recognize disease before it comes a crisis, right? But there's a second diagnosis we've learned to make over the years, and it isn't about patients.
It's about a system that's supposed to catch the patient, right? Today, we're going to walk through 3 active outbreaks, the current numbers on each, and staffing and leadership pictures behind them.
Because public health emergency doesn't announce itself. We know that, right? It doesn't call it by name. Sometimes it announces itself by what? An empty desk.
So let's start with something concrete and verifiable. As we tape this, the Center for Disease Control and Prevention does not have a Senate-confirmed director.
And the Office of HHS responsible for the National Preparedness and Response, the Assistant Secretary for Preparedness and Response, does not have a confirmed leader either.
Here's how we got here. The administration's first pick for CDC director, Dr. Dave Weldon, was withdrawn before his hearing. The second, Dr. Susan Monarez, was confirmed by the Senate in July of 2025 and then removed from her position in under 1 month.
A month. And several senior CDC scientists have resigned in the aftermath of all of that. And that's not a rumor. We know that's public record.
So the third nominee is Dr. Erica Schwartz. She's a physician. She served as Deputy Surgeon General in the first Trump administration, and she was nominated in April. Her confirmation hearing before the Senate's Health, Education, Labor, and Pensions Committee was on July 15th.
And what stood out about this to us was that the hearing, it was the pressure that came from both sides of the aisle, not really a party line grilling, though.
So, Senator Bill Cassidy of Louisiana, a Republican, a physician himself, and recall he cast that deciding vote for RFK Jr., he chairs that committee. And he said plainly that the country does not need a CDC director who will, in his words, just take orders.
Yeah, and then Senator Bernie Sanders pressed her on the CDC webpage about autism and vaccines. And then Senator Maggie Hassan pressed her on the documented political direction of the CDC staff itself.
So Dr. Schwartz told the committee she would never betray the science and pledged what she described as radical transparency in rebuilding public trust. She also said the agency has suffered from mission creep and should refocus on infectious diseases.
And then this week, the vote, it didn't happen, you guys. The committee had to schedule a July 23rd vote in advance of her nomination, but it was postponed because the chairman cited a family emergency affecting the Republicans' attendance needed to move forward. So the committee said it planned to vote for early next week.
So the nomination for the preparedness post, Sean Kaufman, for Assistant Secretary for Preparedness and Response, he was actually pulled from that same agenda and pushed to July 30th. A committee spokesperson pointed to ongoing conversations with the administration.
So let's be precise about what that really means. These 3 simultaneous outbreaks, right, that's going on in the United States, and the 2 federal positions whose entire job description is to answer to those outbreaks, as of yesterday, unfilled once again. So now let's put the leadership picture next to the actual caseload. So start with the one that most Americans have never heard of, Let's run this clip.
Parasite spreading today, likely through some fresh types of produce, and it's sending people to the hospital with which doctors are calling explosive diarrhea. And here's the thing. The CDC used to conduct surveillance on this very infection through a program called FoodNet. But in July of 25, thanks to Trump, CDC made reporting on that illness optional. Now we are here a year later, and we're already seeing over 7,000 confirmed or under investigation cases and over 100 hospitalizations with no single cause having yet been identified, and those numbers are growing every day. So Dr. Schwartz, you are a physician. You are a public health expert. Is there any scientific or medical justification for CDC having eliminated mandatory reporting of that parasite?
Senator, this is the first I've heard of that. Cyclospora, as you know, is a terrible, terrible disease. As you mentioned, watery, explosive diarrhea. It's something that you would not want anyone to experience.
So you were not aware that this was canceled a year ago?
Senator, I was not aware of that.
If you are confirmed, do you commit to reinstating the required reporting for Cyclospora?
You have my commitment to work with your staff and work with the CDC scientists to understand what can be done, why did it stop, and what can we do moving forward.
Well, okay, it is the job of our public health agencies to catch outbreaks like this and to take action, and it's hard to do when you have removed the reporting requirement or fired expert staff or undermined trust in public health. So for the record, to me, RFK Jr. and Trump's war on the CDC is now landing people in the hospital.
Yep. Once again, that was a great political answer, though.
Oh my gosh, the diving and hedging she did there was just phenomenal. But that's still, Cyclospora. It is a microscopic parasite, Cyclospora cayetanensis, and it spreads through contaminated fresh produce or water. So it's not person to person in everyday contact, and that matters enormously about how you stop it.
And clinically, what we've seen is this prolonged watery diarrhea, cramping, nausea, profound fatigue, and weight loss. If it's untreated, it can go for weeks. I cannot imagine. And the complications are malabsorption, gallbladder inflammation, and reactive arthritis. That's up our alley.
And so here are the current federal numbers. As of July 15th, the CDC issued a Health Action Network advisory. And since May 1st, the agency has confirmed 1,645 domestically acquired cases across 34 states. And it is aware of more than 5,100 additional cases still being analyzed. And just remember, we're not quite tracking this disease.
Yes. And so for comparison, last year at this point, there were only 249 cases, you guys.
So of the confirmed cases with available information, 141 people, about 9%, were hospitalized, and no deaths have been reported.
But that's the national picture. When you talk about investigators identified these tight clusters of more than 400 people that were linked to cases like in Michigan and Ohio and West Virginia and Kentucky. That's a lot.
Yeah, and on July 17th, Taylor Farms de Mexico recalled all iceberg lettuce sourced from central Mexico. And the CDC advised people not to eat shredded iceberg lettuce served at Taco Bell locations in Indiana, Kentucky, Michigan, Ohio, and West Virginia.
And now here's the part that connects us back to our thesis, if you will. Nobody found that lettuce by accident, right?
No, somebody interviewed hundreds of sick people about what they ate. Somebody ran the specialized stool testing because Cyclospora does not appear on your standard lab panel unless a clinician specifically orders it.
Yeah, somebody had to compare the data across state lines, and somebody had to trace the distribution chain back to that supplier in another country. So that's weeks of skilled human labor, intentional.
Right, and Secretary Kennedy has said that the outbreak is under control. We note that the CDC itself has said the true number of illnesses is likely higher than what's been reported because cyclosporiasis is routinely underdiagnosed. So then we've got the second outbreak, right? Measles.
Yeah.
This one just crossed a line in the United States that our United States hasn't crossed in a generation. With the Johns Hopkins measles tracker, as of July 22nd, 2026, we've got 2,295 cases. This tracker actually pulls from state and health departments, and it updates more frequently than the federal count. But again, this puts that national figure at 2,295 cases in 34 states. Dr. Sloan?
That's crazy. So because the number matters, if you remember in 2025, the total number of cases was only 2,289. And we've now passed a full year's worth of measles in 7 months, you guys. That is the highest number annual count in 35 years since 1991.
So since 1991, there's some of our viewers who were not born in 1991. Right? So, the largest clusters this year, South Carolina, centering on Spartanburg with roughly 670 cases. There's Utah with 518 cases, and there's Texas with 182 cases.
Yeah, and those are the ones that are documented, right? So if we put the clinical picture together for you, so measles is the most contagious infectious disease we know. And one infected person can transmit between 9 to 10 people that are in close contact. And that virus can hang around in the room, in the air for 2 hours after that person has gone.
And the complications include pneumonia, severe ear infections, encephalitis, which is brain inflammation that can cause permanent damage. And just as a reminder, the susceptible people to measles are those that are not vaccinated or those that could not be vaccinated for medical reasons, right, Dr. Sloan?
And what we really want parents to know and people to hear is that 93% of this year's cases were people as Dr. Brown just said, unvaccinated, versus those that were vaccinated, unknown, but 4% had both the measles vaccinations, both doses. So there's some crossover, but the numbers are so much less if the vaccines were had.
Because we solved this problem before, right?
Mm-hmm.
But in November, an international body will decide whether the United States still even qualifies as a country that has eliminated measles.
Yeah, we earned that status in 2000. Now here it is, 26 years later, and we're going to lose it. Because of who? I'm not saying his name today. But as the third outbreak, let's talk about the one that is touching multiple continents now. Let's run this clip.
Dr. Schwartz, just want to go back to you. A huge part of CDC is about protecting America, especially when it comes to global health work. And I guess I just wanted to ask you your thoughts, whether or not the withdrawal that the Trump administration set forward from the World Health Organization makes the American people more or less safe globally.
Senator, I think the World Health Organization does amazing things. But I also agree with President Trump that it was incredibly bureaucratic. And the Centers for Disease Control was doing the heavy lifting throughout the time that the World Health Organization.
So you think it's making us more safe to no longer be in the World Health Organization?
I think what's so brilliant is that the President and Secretary Rubio have something called the American First Global Health Strategy.
And that's better than being a part of the World Health Organization? It's not something that we could do an additive to membership there?
The American First Global Health Strategy, its purpose is to prevent diseases from coming to the homeland. And the Centers for Disease Control is working synergistically with that American First Global Health Strategy.
So you think we're better off now than we were a year and a half ago?
I think we are protecting the taxpayer.
It's not that hard of a question.
Just answer the damn question. I mean, it is not that hard, really. Seriously.
She's so well prepared, though, right, to dodge.
Mm-hmm.
So on May 17th, the World Health Organization declared that the Ebola outbreak in the Democratic Republic of Congo and in Uganda, those have now been declared a public health emergency of international concern. And the strain is a Bundibugyo virus.
Yeah, that strain detail matters more than it sounds. Most existing Ebola vaccines and treatments were developed for the licensed against the Zaire strain, but the Bundibugyo is a different species. And which is why the World Health Organization has had issues in emergency listings and new diagnostic testings and to launch a trial that would even identify effective treatments.
And the numbers, as of the data reported through July 20th, the DRC had confirmed 2,473 cases and 999 deaths, with 737 patients hospitalized in isolation and 482 recovered. So reporting since then has pushed the death toll past 1,000.
That is the case fatality rate, and that range is around 40%. So we can't just sit idly by and not communicate about this and not be part of the World Health Organization.
Clearly. right? The Ituri province is the epicenter with 2,202 cases and 838 deaths. 47 of 140 health zones across 5 provinces are affected, and Uganda has reported 20 confirmed cases and 2 deaths. And that's now begun this 42-day countdown to declaring that the outbreak was over.
Now, the part that makes this an American story is that in June, France reported a confirmed case in a physician returning from the DRC. And on July 10th, the CDC reported that a U.S. citizen working in a humanitarian organization in the DRC had tested positive. That patient was medically evacuated to Germany on July 13th.
Regardless of who occupies the White House, regardless of who serves as HHS secretary, regardless of who ultimately runs the CDC.
Every American is entitled to ask a short list of questions and get a straight answer.
Are there enough trained people to investigate the outbreak?
Are their laboratories staffed?
Can a local health department reach every exposed family in time?
And will hospitals get accurate guidance quickly?
Will physicians be able to trust what they're told?
And will the public be able to trust what they're told?
Because a parasite in a bag of lettuce does not check who you voted for.
And measles virus in a pediatric waiting room does not ask about your politics.
And Ebola on a 12-hour flight does not care about any of it.
The disease treats every community exactly the same. How we prepare, though, is the only part of the equation that we can control, and we are out of control right now.
So here's where we'll leave it. Cyclospora is a reminder that our food supply requires constant vigilance. Measles is a reminder that a disease we defeated can come back, and that in November, an international review will decide whether we still qualify as a country that even eliminated it.
Yeah, and Ebola is a reminder that global health and American health were never separate things.
The strength of a health system isn't measured by the hospitals we build or the technology we buy.
It's measured whether we have the people, the expertise, and public trust to answer the phone when the next emergency calls.
The next crisis will not wait for a confirmation vote, and preparedness is the one thing you cannot build after you need it.
So we are AYA. We want you guys to stay informed, stay vigilant, and stay loud. We are contributors to the MeidasTouch Network and proud members of the Meidas Mighty. Please subscribe, share, like, and follow for more updates. Have a great week.
Thanks for watching. Be sure to add the MeidasTouch podcast on Apple Podcasts, Spotify, or wherever you get your podcasts for new updates every single day.